Good afternoon, everyone. And I don't think I'm in the wrong room. We're not here to talk about highways. It is nice to be able to end this Friday on a really high note, something that I believe is a success story in Arkansas in terms of cooperation, in terms of getting things done, in terms of looking out after the health care of our citizens, but also looking out after the taxpayers at the same time. And I wanted to recognize the legislators that are here. We have many of them that's worked very hard during the special session. Thank you all. Great job that you've done. And Speaker Gillum, I understand, is here. Speaker, are you here? And Speaker's back there. Speaker, why don't you come on up here if you don't mind, just so you'll be on the front row. And President Dismang, so terrific. Come on, join us up here. But we have all the legislators, and many of them worked on the task force that really presented some ideas and gave us a venue in which to talk about how we need to achieve savings and greater opportunities for improved care. And I'm delighted to be joined here by Cindy Gillespie, our Director of DHS, Rachel Davis, Director of the Arkansas Healthcare Association, Craig Cloud, Director of the Division of Aging and Adult Services, David Norsworthy, member of the Board of Directors of the Arkansas Healthcare Association. And most significantly, we have over here some people that are working every day in the long-term care industry as nurses, as care providers. Thank you all for joining us as well. And I was confronted by a very interesting statistic, almost a daunting statistic, that by 2025, there'll be a 25% increase of those Arkansans who are in need of long-term care services. That's an incredible statistic. By 2025, a 25% increase in those 85 plus and those that will need long-term care services. And so an expansion of need, and yet even with that, we have an agreement that we are presenting today that will take on this challenge and say we can meet this challenge of increased need for services not by increasing the number of beds in nursing home facilities or long-term care facilities, but by providing more options, more community-based support, and tiered level of services that will give more options and better care for our senior citizens, and making sure that we have our long-term care facilities priority on those in need of acute care. And so this is incredible progress for us. We'll be signing an MOU with the long-term care industry, and it will do a number of things. One of it will be a rebalancing of the service that we provide. We will be keeping more people in their homes and in their communities rather than simply putting them into nursing homes. That does not mean that we're going to change the need for nursing homes, but we're going to give more options for that. And again, to reserve those that have the greatest need that will have the long-term care facilities. And then secondly, this will be accomplished by an independent assessment. So rather than simply automatically having someone assigned to a long-term care facility, they will first be assessed as to what their level of need is. And if they can be cared for in their home or a community-based service with support, then that saves the taxpayers money, but it also provides more independent living for the senior citizen. And then you'll have the tiered level of care as well. Finally, this will allow us to achieve a goal. And I know I started out months ago talking about the need to create $250 million in savings over 5 years, and that the long-term care industry has agreed to accomplish those savings. But I think that starts actually with the wrong lead. While that is very important, it is the care, it is the options, it is the community-based services that are important as well. And so, but it does lead to the savings. And so this agreement that we'll be signing today accomplishes our goal of achieving $250 million in savings over 5 years within the long-term care industry. And I want to applaud the Arkansas Healthcare Association, other leaders of the industry that have joined with the intense negotiation over the last few months to accomplish this objective. And that is my final point, is that this is a model of cooperation. It is a model of industry leaders and government getting together and saying, how can we do this better for our citizens and for our taxpayers? And because of that, a rather specific MOU has been agreed to, and we also have a timeline for the reform that's very specific on the planning, on the waiver application, on the federal negotiations, and the implementation period. And so I am delighted with this, and I want to congratulate, and let's give them all a round of applause for the success of their achievement. And with that, I wanted to introduce Rachel Davis for her comments.
Thank you all so much for being here today. On behalf of the long-term care providers in the state, our nursing homes, our assisted living facilities, and especially our caregivers that work so hard every day in our facilities, we're really excited about these reforms and excited about the opportunity to make some needed changes that will allow us to continue to improve our quality. We're fortunate to have great nursing homes in the state of Arkansas, both rural and urban areas, and we want to see that to maintain as a viable option. And we are excited about working with members of the General Assembly and the task force to accomplish these goals. And the governor laid out some pretty strong objectives to us back in December with some savings and some certain things that he wanted to see in place. And we've worked hard on putting this program together, and we'll be working with providers across the state, the area agencies on aging, and other long-term care providers, both in the community and the institutions. And we appreciate your support on all of these efforts.
Thank you, Rachel. And now let's move over here by the table. I'll sign this agreement, and then we'll come back and take questions on this topic. And if there's questions on another topic, we'll address those as we need to. But if y'all can join me over here. This is what I like, an agreement that's already signed by 3 parties. So mine's the easy part. This memorandum of understanding between the Arkansas Long-Term Services and Supports Reform, Arkansas Department of Human Services, Arkansas Healthcare Association is signed this May 20, 2016. By Cindy Gillespie, Director of the Department of Human Services, Craig Cloud, Director of Division Aging and Adult Services, Rachel Davis, Executive Director of the Arkansas Healthcare Association, myself as Governor. Thank you all very much. And now we'll take any questions, and if we have any real tough ones, we'll have these nurses over here take care of that.
Is there still an agreement that if the savings aren't produced, that you would hire managed care companies to take this over?
The agreement is a pledge, and we do believe the $250 million in savings is a floor. We actually believe we can achieve greater savings than that, so that's not the ultimate objectives. But in terms of if we want to make sure that this is measurable, and the way we have it constructed, and I'll let Cindy or others correct me if I'm wrong, but the way we have it constructed is that those savings are guaranteed and withheld from the a lockbox to accomplish that. And so we're confident that this will be achieved and those goals will be met. Rachel's.
So what happens if somebody else is governor?
Well,
It said 5 years. Are you announcing for re-election?
why do you want to engage in idle speculation? This is a commitment with the long-term care industry to achieve these savings. We'll have the waiver requests and approvals by the federal, so it'll really be institutionalized in terms of the changes. And I would suspect that it would have broad support and it would continue. Cindy, do you want to come up here? I just want Cindy to say something. She can say anything she wants to say.
Hi. No, you said that exactly right, because as you'll see from the timeline, over the next, year, we will put in place many of these changes. They'll be done through the rules, they'll be done through the waivers, they'll be done through the rate changes. And so at that point, it's not that anything goes on automatic, but we'll be into implementation. So someone would have to decide to completely reverse course. And since I can say anything I want, I think what I'm going to say is this. This is an initiative that, as we've been working on it, I will tell you, everyone involved keeps bringing up personal stories. This is very near and dear to everyone's heart, because we all have parents who are aging, and those with gray hair see ourselves coming along as well, right? And I think we all want to make sure that in Arkansas, we have put in place the structure that allows us to have people remain in their home and community as long as they can, and then equally a really quality structure, continue the quality structure we have, and continue making it better so that as someone gets to the point in their life where they need to enter a nursing home and they need skilled nursing care, that's available for them as well. And if we can do that, then we will have done a great service in the next few years for the future of our society here in Arkansas. And it's been interesting to me, all these stories. So I have to point out that Craig Cloud has a personal story here today. His grandfather is here today. So I just want to say hello and honor you for coming. But this is like all of us. So that's what this is about. And a special thank you to all the providers who are going to work with us to make this possible, because this isn't something government does. This is something we all do. Thank you.
Speaker, Mr. President, you all have anything?
Is there a particular reason? I mean, is it like standard industry practice to have a 5-year MOU as opposed to a 10-year MOU? Or I'm just trying to understand. 5 years.
Correct.
Yes, sir. Mike, I think our ultimate goal, obviously, as the governor and Cindy and Rachel said earlier, is to definitely strengthen our continuum of care. But ultimately, when you look at the population growth over the next few years, it's critical that we try to achieve the smart rebalancing as quickly as we can to achieve these savings and efficiencies in our program as quickly as possible. We feel confident and optimistic that we can do so as we continue to work together to move forward.
But also as characterized that we needed to have $250 million in savings over 5 years. And so that was the objective that I set out as governor, and they've accomplished that.
What's the plan as far as the other parts of, like developmental disabilities and mental health for those populations, creating the savings in those areas?
Well, good question. And here again, I applaud the long-term care industry that came to the table very early on and said, we'll work with you to accomplish these savings. We set out the objective. Now, in terms of the disability population, the behavioral health population, we've had a debate on managed care. We've not been able to, by simple agreement, work out the necessity of independent assessments and the savings there. So that is still work to be done, both in terms of the savings and discussions with industry. And the debate will continue over the potential for managed care in those segments as well. So that's still work that's on the table. And so, we're going to work internally within DHS to create savings. This is a part of it. There's other work that we can do outside of managed care, and we'll continue that path towards savings. All right, well, with that, we will adjourn this. I know some of you might have questions about the legislative session. If so, I'll come back shortly, but let me thank everybody for being here today. And again, let me thank the legislators who have had a long week and have put in an incredible amount of work in a short amount of time. I know you're coming back Monday to finish up, but I want to personally thank you for what you've done during this session.